Well, today we are pleased to welcome our guest speaker, Charmaine Anderson, a licensed prevention specialist, professional program monitor for Imcal. This webinar is being recorded. Also, all lines are muted. Please put your questions in the chat box. However, we're going to ask that you hold the questions until the end of the webinar. With that being said, ask that you give your full attention to Miss Anderson, and let's help welcome her. Here you go, Charmaine.
All right, thank you. I actually brought one of my cohorts with me, Mr. Gene McDonald. So he is from our Developmental Disabilities Division. Gene, you want to introduce yourself real quick?
No, but I will anyway. I'm Gene McDonald. I'm the entry unit supervisor, and I'm the placement coordinator for the Imperial Calcasieu Human Services Authority region. That's not the only hats I wear around the office, but those are the big ones. So if you're applying for services or looking at ICF-DD placement / group home, I would be the one you'd talk to first.
All right, thank you. So let me go ahead and share my screen here. Just a second, pull this up. All right. Can everybody see it? Can you see it, Gene? Everybody, thumbs up.
Yes, ma'am.
Fantastic. Fantastic. So like you said, we are Imperial Calcasieu Human Services Authority. We have two different divisions. We have our behavioral health services, which does, our mental health and addiction and gambling treatment. And then we have our developmental disability services as well. And I'm not going to sit here and read these slides because y'all can see them. So let me click. My arrow buttons aren't working. Okay. So who are we? I just said, we were created from a legislative order. Basically, we are kind of a quasi-state agency. We still receive funds from the state of Louisiana and the federal government in order to treat kind of the indigent population and provide services and connect people with services that they need for our area. We cover a 5-parish area, which is Calcasieu, Cameron, Burgard, Allen, and Jefferson Davis parishes. We're governed by an 8 board member. We're called a local governing entity. And we have, like I said, 8 board members, and we have 3 governor appointees. And these are our governors, these are our board members. In each of the parishes, like we see, you see that we have one from each parish. That's very important because we want each of our parishes to be able to have a say in our services and what their citizens do need. Because it's not just us, sitting in Lake Charles, Louisiana, that we serve. Our executive management team, you see, Tanya McGee, I'm sure most of y'all know her. She is our executive director. And you can see kind of everyone, all of our important team members. Of course, all of our team members are extremely important, and these are our fearless leaders. Our mission basically is so that the citizens of our 5-parish area can have a fully productive life and can be, fully productive citizens and can, live the best life basically that they can is what we try to do. Our behavioral health division, we have 5 outpatient clinics. In Calcasieu, you see that it has a 2 next to it. We do have 2 in Calcasieu. We have 1 in Lake Charles and 1 in Sulphur. Our Sulphur clinic is actually now our largest clinic. We do have, and in our 2 largest clinics, which is Lake Charles and Sulphur, we do have, we'll talk a little bit about, we'll have a pharmacy, and we have some other things in our Lake Charles clinic too. that we're able and we have the room to be able to provide. We are CARF accredited, which is the Commission on Accreditation of Rehabilitation Facilities. We do have a CARF accreditation coming up, so we will be preparing for all of the paperwork and everything. It takes us about a year in order to prepare for our for that accreditation process, and it's every 3 years that we're accredited. You can see that we take all major forms of insurance, Medicaid, Medicare, private pay. Like I said, we are quasi-state agency, so we still work on a sliding fee scale. So, you know, regardless of your ability to pay, we're still going to treat you. We do ask that you verify your income every 6 months. So we just kind of put that up front. And you can see about where we, you know, we have the payment plans and that the sliding fee scale, which is based on the, you know, the poverty scale. All right, so we do have some individualized programs in that we do treatment for adults, adolescents, and children. You can see, can everybody see the screen? I have like this little, I'm gonna put this down here because it's bugging me. So we do have a multidisciplinary team comprised of social workers, professional counselors, addictions counselors. Like you heard, I'm a licensed prevention counselor. I was a certified addictions counselor, but you know, I don't counsel anymore, so I don't keep that that certification up. But of course, we have nurse practitioners, you know, a pharmacist, like I said, and we do have a dietitian on staff that does help with our clients and that. So then not only does the dietitian is she available for our clients, but she's also available for staff. So we can be as healthy as we need to be as well. We do psychiatric and psychosocial evaluations. Basically what that is trying to get the history so we can determine a diagnosis. And the more history that we know, the better. We have individual, group, and family therapy. Like I said, we do outpatient for addictions, and we do have, we can do intensive outpatient treatment and referral for referral to like inpatient treatment services. We do have one adult inpatient treatment facility here in this area in Lake Charles. It is operated by Odyssey House of Louisiana. It's the Joseph R. Briscoe. We used to be, we were over that facility. We still are. It's a contract with us. But when we started privatizing facilities in the state of Louisiana, that went out on contract. And we have to say that they have been able to expand the services that we were not able to do as a contractor. We have medication-assisted treatment for especially our opioid addicted clients. You know, that's a huge problem right now in this area is, you know, pain medication, heroin, and fentanyl, especially fentanyl overdoses. We are second in the state, just behind New Orleans, pretty much. Last year, we handed out over 10,000 cases of Narcan, which has shown to help because our overdoses are actually going down. So that's something that we want people to access treatment. And we understand that sometimes it's a little hard to get off of certain substances. And so we just want to make that available for our clients. And medication management. Why do we do medication management? Because maybe you don't need therapy as much, or maybe you only need to see your counselor once a year. But medication management basically is us putting our eyes on you. We're basically kind of taking your temperature, you know, so to speak, to make sure that you're doing good and that your medication is working. Because you can tell me all day that you're fine, and I know all of you probably know this because, you know, during COVID everybody was fine, but it's okay to not be okay. But we need to put our eyes on you. We need to see if it's still working, and if it's not, then we need to tweak it and do whatever we need to do about it. So like I said, we have an on-site pharmacy. It depends on how you want to say it. We call it Genoa or Genoa, however you want to say it. We have one in our Lake Charles clinic and in our Sulphur clinic. And actually, it's not just for our clients. Most of you have, or if you have Blue Cross Blue Shield insurance, it's that pharmacy. Actually, if you look for a pharmacy that you can have your prescription filled at, that pharmacy actually pops up. So it is open to the public if you want to get your prescriptions filled there as well. Our I'm Healthy, which is primary care services. We know that it is sometimes really hard for our clients to make several different appointments, and so this is a way for us to kind of have it a little bit streamlined and easier for our clients. They can come for their therapy session or their medication management session and schedule their I'm Healthy appointment. Like say if they have high blood pressure, they can have that checked, diabetes or whatever. They can schedule all those services within, the same day. So that way they don't have to run around town, or they don't have several different places that they have to be in a week or a month or whatever. Like I said, we have dietitian services, our child and adolescent response team. I know some of you have actually had interactions or have had to call the CART team. It's amazing. Basically what they do is when you call the CART crisis response line, they'll try to diffuse the situation over the phone. If they cannot diffuse it, then they will send someone out. And like I said, our team is amazing. They will send someone out to diffuse the situation. And they will also help school, family, whatever, try and access some of the services in order to make them, as healthy unit as we can. We have the living in balance, anger management, and of course we use evidence-based programs. Everything that we do is evidence-based, or at least, and in prevention, it's evidence-based or evidence-informed. I can tell you that. Peer support specialist, because a lot of times, who's better to kind of guide you some of the time than someone who's kind of lived it with their lived experience. So they're an extremely important part of our team. Our consumer care resources. I know some of you in Families Helping Families, have been able to access that for your clients. And of course, we have recovery housing stipends as well. Because we know that in this area, especially after the hurricanes, we do have a housing shortage. We do have, and of course, COVID, everything closing. We know that a lot of our community members are, we don't have as many services as they need in our community. So we do have some of the, community-based services. We can do referral to case management, of course, crisis supports and services like crisis housing. And then, like I said earlier, residential substance abuse treatment or inpatient treatment, however you want to put it. So our access to care unit, basically, this is kind of our red carpet people. They're the person that when you call, they're the person that's going to do the screening. When you see that our priority populations are pregnant IV users, and then especially if they're pregnant and IV user, they do a phone screen to make sure that you're appropriate, that for the services that we offer. If you're not appropriate, then they can refer you to somewhere, or they can refer you to an intake unit or whatever. And they get all the good referrals from all of our inpatient treatment facilities for clients that are coming back to this area. And of course, we have our walk-in clinics, and I think I'll have a slide on here with that. And sometimes our walk-in clinics are the easiest in order to kind of access services. So let's see, let me move on. I believe the next one is I thought I had our walk-in clinic times. I think I'll have it maybe later. So this is our admission criteria for children and youth, basically for mental health services, 0 through age 17. It just depends on, whenever they start showing signs of emotional or behavior disorders, which could be the teacher, school, daycare, whatever parents are seeing. And so they can access services basically any age. Our outpatient substance abuse services for adolescents, they have to be between the ages of 12 and 17. We have had some over 17-year-olds that we do keep with the younger, with the adolescents, because of their, it just depends on their level of understanding. It also depends on, a lot of other things, their clinical severity and that. So we do take into account a person's level and kind of where they're at in their life and their age. And there's quite a few things. There's some criteria, and I believe I have it listed. Yes, here's the slide. It talks about it. But here's for adults. You have to be at least 18 years of age. You have to, of course, have acute stabilization needs. You know, having suicidal ideations, homicidal, you know, grave disabilities, active psychosis. You know, but you, like we said, you cannot be an imminent danger to yourself or others, because then that elevates your level of severity, and that means that we need to, you're probably going to need some type of inpatient treatment. So, you know, of course, for addictions, you have to have an identified alcohol, drug, or gambling problem, which can be co-occurring with a mental health disorder, which I know back in the day we're like, okay, what comes first, the horse or the cart? But, you know, it comes together sometimes, you know, so we have to be able to, and of course, like I said, our staff is able to treat both addictions and mental health diagnoses. So, of course, a diagnosable condition. Like I said, if you don't already have an identified, you know, mental health disorder or substance use disorder, that's why we do the psychosocial assessments and that, so that way we can see and make sure that we're diagnosing you with the proper thing. And like I said, we have we have a level of care, especially for our addiction services. We know we have a level 2 of care and access services for all of our divisions. In particular, the behavioral health division uses an ASAM, level of care criteria. And of course, like I said, you may graduate from our services, but you may have to seek our services again at some time, because we know that that can be a struggle. You will always, you know, have your mental health disorder. You will always have your substance use disorder. And, you know, that is lifetime recovery. So sometimes you might have to come and we have to give you some supports. So where are we? Like I said, we have our Lake Charles, our Sulphur, our Burgard Behavioral Health is in DeRidder there on Port Street. Our Developmental Disabilities Division right now is on Fifth Avenue. Our Jefferson Davis Clinic is on Market Street, and then our Allen Clinic has just moved from Oberlin to Oakdale. So make sure you note that. I believe we have that changed on all of our brochures and our information. Our administrative division is off of Wolf Circle right now. As most of you know, you see that the tower is coming down. Our developmental disabilities division and our admin yeah, we were we had the whole 20th floor. So of course after Laura we were displaced, and so now we are in 2 different places. They're in Fifth Avenue and they're sharing 2 and 3 to an office, and we're on Wolf Circle and we're sharing 2 and 3 to an office. So sometimes we're in the office, sometimes we're not. It just kind of depends. Because it's a little hard sometimes, especially doing a presentation like this when you have 2 and 3 people in your office. So here's our walk-in clinic schedule. You can see that, you know, like in DeRidder, it's Monday and Wednesdays. In Jennings, Tuesdays and Wednesdays. In Lake Charles, it's Monday through Thursday. Medicare, particularly Tuesday and Thursday. Our Oakdale clinic is Tuesday and Thursday, and then our Sulphur clinic is just Thursdays, 7:30 to 2. Like I said, sometimes that's kind of the easiest way to access our behavioral health services. But and you can see up at the top that days and time are subject to change. It just depends on our staff members. Our developmental disabilities division, yay! So our developmental disabilities division is basically the single point of entry for several services in the system. So of course they provide and try to, you know, support coordination of services to individuals and their families, because it is both very important for that individual and their family. Like I said, We want people to live the best lives that they can, and we want that family unit in order to be as thriving as possible. The waiver program, and Jean, you can chime in anytime you want. Our waiver program allows services to be provided in the home or community-based settings, and then or who would ever, otherwise would require institutional care. Our family support program is designed to assist individuals whose needs exceed those normal resources. So kind of like a different level of, what they need. So like specialized clothing, nutrition, family, education, utility cost, or costs that are for services that aren't covered. So like maybe if a student needs like adaptive technology for school, something that maybe their insurance doesn't cover. Our flexible family program.
And to speak on family support, one thing I often hear from families is, I don't want to take anything from anybody else that needs it more. That I always tell the family, call and ask for something. We have to prioritize the requests as they come in. We look at what we have, a level of needs priority system, and we serve those who have a more urgent level of need first. So if you have something you need, ask. Some years we have our funding goes further and we can help some of those lower priority needs. Other years it doesn't. If it's a crisis year, God forbid, ask and we can take a look at it. You're not going to ever be taking something from somebody else who needs it more. So don't let that be a concern that stops you from requesting something.
Thank you. Yes, definitely. And we are very, very good stewards of our money. So we can help as many as we can. Like Jean said, some years, our money goes a little further and sometimes it's not. But the important thing is that we're getting needs met that these families have. So like he said, if you have something, ask. If we have it, if we can do it, then we will most certainly try to fulfill that. And you see the Flexible Family Fund Program, which is to assist families with children that have severe or profound disabilities. And of course, they have extraordinary cost. We know that when your child has a disability, sometimes it is very hard in order to get the things that they need met, because our funds, especially with the grocery bills going up right now, it's hard to meet everything else that you in your home that you need. So, and you see that it provides a monthly stipend for qualifying exceptionalities, like I said, identified through their local education authority. Community Services Division, that is the division that I am housed in, which is prevention. So some of the things that we do, suicide prevention. We are over we do have it on another slide, but I am the chairperson for the Southwest Louisiana Suicide Prevention Coalition. We do a lot with 988. 988 just released their dashboard, their 988 dashboard. So you can actually see their calls and some of the data that they're getting. It is through Violink in this area. In North Louisiana, the call center is housed in actually CORE, which is our gambling treatment and crisis line. So they're the ones that answer the calls up in North Louisiana. But they're local partners, so like 211 or 232 help. And so they can, even if it's not about suicide, even if it's just a crisis or you just need to talk to someone, you can call 988. One of the things that I do inform people, though, is that 988 does not dispatch to 911 unless it is an emergency. 911 does not dispatch at all to 988. They will tell you to hang up and call 988. And I will tell you there are rumblings that in the state of Louisiana that we are trying to get that worked out, where 911 will dispatch to 988 if somebody is in crisis. So you see assist and safe talk are two different trainings that we do. We have local assist trainers, which basically teaches you how to do a suicide intervention. Safe talk, local safe talk, and some in-house safe talk trainers, which is like 3.5 hour training to teach you on how to look for the signs of suicide and how to ask someone, because it is really hard to do. And then what to do if they say yes. And then assist just takes it a little bit further, and it's actually a 2-day training. Assist can be, we can do assist training for anyone 16 years and older, and we can do safe talk training for anyone 15 years and older. And actually right now in the state of Louisiana, we are a pilot for evidence and collecting the data in order for assist to be evidence-based, to be provided as part of prevention programming across really the United States, for in high schools, especially for programs like the pilot program at Sam Houston, which is kind of a peer support. And some of them are trained in assist in order to be able to, to assist an adult at the school to do a suicide intervention if needed. Of course, we do the AFSP. Y'all know the AFSP, the Out of the Darkness American Foundation for Suicide Prevention Walk is coming up in September. I encourage everyone to participate. We also have our Don't Suicide Yourself website landing page within our Imcal services website, imcal.org. We do have, like I said, evidence-based programs. Everything that we do, treatment, prevention is evidence-based. These are just some of the ones that we have used and that we do use. There are thousands and thousands of evidence-based prevention programs. Life skills, basically it's that. It is a substance abuse prevention program, but it also teaches life skills, which is not necessarily taught within schools now. Generation RX has a elementary, teen, high school, college level, and an older adult Generation RX. Basically what it does is it teaches you safe medication practices, safe disposal practices, and why you shouldn't share your medication. I've already talked about assist and safe talk. We do have Too Good for Drugs as well, which is a prevention program. This past year we have added through Stanford University, it's called Safety First. It's for basically like those adolescents who have been already, say they were caught with vape, or they were caught with drugs or whatever at school. So they're kind of like a heightened level, and it's a little more in-depth prevention to try and get them not to, use anymore. We give them the tools, of course they have to make their own decisions, but Tobacco 21 or SINAR and is a contract that we have with a local person. Basically, they go out and they do compliance checks. We do not write tickets, but we do give them education. You know that no one under the age of 21 should be purchasing tobacco, should be purchasing vapes in the state of Louisiana. So our person goes in, they send someone who's under the age of 21 in to try to purchase a tobacco product. And if the merchant reaches for the product before they ask for the ID, then it is considered a sale. And so our person goes in and gives them some education. We are not the ATC, we are not the state police, we're not law enforcement, we do not write tickets, but had a law enforcement agency come in and done that check, you could have possibly been, issued a citation for selling to someone. And then basically if they do sell it, or if they don't sell it, we have two different cards that the adolescent will lay on the counter. One that says, thank you for not selling to me, and with some facts about, addiction and tobacco and nicotine. And then if they do reach for it, then it says, had you have sold that to me, no, thank you, I'm such and such years old or whatever. And no, thank you. But, had you sold to me, I could have been, this could have been the potential health factors that could have plagued me throughout my life. So we do lots of information disseminations. We are in the community a lot. We do table setups for fairs, festivals, community events, health fairs, targeted presentations like this. And one presentation that we get a lot right now is on vaping. So we've gotten quite a few requests for presentations and information on vaping, because we do have a lot of our schools are experiencing a lot of referrals to child welfare and attendance for vapes, for being caught with vapes in schools. And we have had some vapes that we know that were actually laced with other substances here in this area. Our ISC team, which is kind of my cohort that sits in the office with me, Eric Daigle. Basically, this is kind of like the old ISC team that a lot of us are familiar with. It's an interagency service coordination. When you have a child that may be at risk of, being out of home placement or school, or, if you have several agencies that need to sit around a table and coordinate services, or I may not be able to do something, but you may have it where your agency may be able to do this. How can we coordinate and help this family unit and help this child, this adolescent, and be the best that they can be. And you can see the criteria there. And I know that I sent the slides to Wallace, and I believe he either sent them before, or he's going to be sending them out. So if you have, specific that you want to refer back to, you can refer back to these slides. These are our Imcal, our lead community coalitions. That's something that that we can do. We can help anyone set up a coalition. My coworker Charlotte and I are actually graduates of the National Coalition Academy. So we do actually have specialized training in that. You see the Beauregard Prevention Coalition, which is a drug-free communities grant, which we wrote for 5 years ago, were awarded. We just submitted year 6 through 10. So everybody please cross your fingers that we get funded for the next 5 years. We were actually, the Beauregard Prevention Coalition was recognized by the Speaker of the House, Mike Johnson, because of the data that we have, and because of everything that the data shows that we've been actually making a difference in Beauregard Parish. So that was something that we were very, very proud of. We have our Jeff Davis Prevention Coalition. If anybody wants to join any of these coalitions, you're more than welcome to. Basically, it was started to combat underage drinking in Jefferson Davis Parish. Let me go back to Beauregard. So Beauregard Parish, it was started to combat underage drinking and prescription drug misuse. For years 6 through 10, we were actually adding vaping as part of our initiatives as well. But the Jeff Davis Parish Prevention Coalition, it's for underage drinking. We just received some like COVID mitigation monies and some more monies that we can address vaping. I don't know if you've seen like the big bright billboards. If you're at night, they're really bright. If you're driving through Jefferson Davis Parish, and it has about our vaping stuff. We have those big billboards too. But in the coming year too, we're going to be tackling on some prescription drug misuse as well. Initiatives like GenRx, and providing medication lock bags and disposal bags within the parish. So that way we can try to keep those medications off the street. And then, of course, like I said, our Southwest Louisiana Suicide Prevention Coalition. We were started in 2008, and we are actually the only coalition in the state that is still surviving and functioning at this time. But we are working on Region 4, getting their Suicide Prevention Coalition, getting up and running. And then we're going to start working in the Shreveport area to get their coalition up and running. Of course, we have some overdose prevention. I know some of y'all may have seen our outreach team, which is the Southwest Louisiana Do No Harm. Not only our office, but they distribute Narcan, fentanyl test strips, sharps containers, lock bags, disposal bags, and all of those things, wound care kits, hygiene kits when they're doing their outreach. Of course, we get that through the state of Louisiana, so sometimes it's a little bit, it's a little bit slower process. But we have our Louisiana Bridge program, which we have people that are in some of our local hospitals. And when someone presents for an overdose, their peer support, they speak with them, and they do give them Narcan when they are discharged, but they try to steer them towards treatment, because you can bring a horse to water, but you can't make them drink. And we know that, so we have to meet them where they're at. Opioids, the challenge in Louisiana through the Department of Health, like we do Narcan training, overdose prevention training, we do talks like that. And like I said, we do distribution of Deterra bags, and then of course medication lock bags and fentanyl test strips, like I said. And in the state of Louisiana, you can administer Narcan, and the Good Samaritan law does cover you. As long as you call 911 either before, during, or after you administer. And the Narcan that we hand out is the nasal spray. And there's 2 nasal sprays in 1 box. I personally carry Narcan in my vehicle. I've had to leave it places. One time I had to leave it I had to go pick up someone at a local facility, and it looked like there were some things going on outside, and so I left my Narcan with the bartender there. Some of our bars, some of our restaurants do keep Narcan on hand for those purposes. But yes, in fentanyl test strips, they were considered paraphernalia in the state of Louisiana. However, they are no longer considered paraphernalia in the state of Louisiana. So anyone can have fentanyl test strips. We do inform them, though, that when you are using a fentanyl test strip, you need to, especially if you're checking, pills or whatever that are off the street, you need to scrape from all sides, because we call it the chocolate chip cookie effect, because not every bite of a chocolate chip cookie has a chocolate chip in it. So just like that, off the street pressed peel could have fentanyl on one side, no fentanyl on the other. And I spoke about fentanyl, but there is also carfentanil, which is an elephant tranquilizer, which if you've seen our billboards, the equivalent of a grain of salt can basically kill you. And here's Pete. Here's our big boy. He is our mobile outreach response unit. We have teamed up with the Office of Public Health, and we have been doing some hepatitis C vaccine, hepatitis C testing in that, and of course STI testing, outreach and education in that. In the Sulphur area, I believe we are expanding to the Jefferson Davis to the Jennings area. So if you see Pete riding around, that's kind of what he's doing. It is a little bit of a feat in order to get Pete to make an appearance, but we get it done. And the reason why he's called Pete, you can see right here, is because our fearless leader for several years, Pete Menina, he's the one that hired me. He's the one that originally hired our executive director, Tanya. He was kind of our cheerleader, and he basically kind of helped us become the people that we are. And so that was something we were looking for a name for our big boy. We wanted it. We settled on Pete as to honor him. And you can see he's 40 foot. Like I said, he's our big boy. He is equipped. There is a medical room. There's an examination room. There's actually a confidential counseling room. He does have Wi-Fi. There's screens where we can do telemedicine. Like I said, there's the door, it closes, and it's completely confidential. Like I said, so we can do medical, we can do behavioral health, we can do developmental disability outreach, through him. Like you see HIV and STD testing and dissemination of Narcan, so he's our mobile outreach. And of course, those rural areas that it's really hard in order to reach. So that's one of the reasons why we wanted Pete as well. And of course, you can see post-disaster response, because that is one of the things that we are, like I said earlier, we are kind of a quasi-state agency. We are all civil servants, and we are responsible for responding to disasters in our area, both environmental and public health. So if you have any questions, like I said, our website earlier, www.imcalhsa.org. Those are our those are our apps. Right now, Google has had a glitch with our app. So if you cannot download it, that would be the reason why. But I know that they are constantly working on it on the back end. But you can find us also on social media. A lot of the campaigns that I talked about are on these social media sites, including our vaping campaign. So if you have any questions, that's it. Does anybody have any questions?
Wow, that's really good information that you've provided, Miss Anderson. I don't see any questions in the chat box. I want to thank everyone for attending the webinar. If you have any additional questions, you can always call our office at 337-436-2570 or email us at info@fhfswa.org. We ask that you please complete the survey from today, from the webinars. They will be emailed to you. And again, thank you for spending your time with us. I personally thought this webinar gave us a lot of good information. The incentives that y'all are putting in place for these programs are very needed in our population, and the fact that the numbers are coming down on the suicides are really good. So
Yes,
it's good.
overdoses are coming down.
The overdose, that's right. I'm sorry.
Suicides are going up.
Right up. That's right. I transversed them.
Right.
But yeah, it's
yeah.
the numbers, the numbers are showing that it's working, and that's good.
Yes, we do. We do a lot of stuff that people don't realize, and stuff that I can't even cover. It would be a whole nother hour. Jean and I both wear several hats.
Right, right. Well, thanks again for joining us. We really we appreciate the information. Y'all have a good afternoon. Thank y'all.
Bye. Thank you.
Bye.